Hello, good people. How are you? I hope today finds you well, and I hope that you are in perfect peace in every area of your life today. So, today is June 24th, which makes it the 24th day of Uterine Cancer Awareness Month. And as a uterine health advocate, I am committed to sharing information regarding uterine health and uterine cancer every day during the month of June. And I also want to take this time to say thank you. Thank you for, your viewership. Thank you for your subscription, your commenting, your liking the videos, all the engagement that you have with this channel. I do say thank you and I appreciate your engagement. I also want to take this time to say that it is in the description, but I like to say it verbally. I am not a medical doctor. I am a uterine health advocate, advocating for all things uterine health, right? So today I want to talk to you about uterine prolapse. I was recently listening to a doctor talk about something, and he happened to mention that in passing as he was talking about something else. And since I had never heard of uterine prolapse, I quickly made note of it and knew that I would be talking about it someday during this month of Uterine Cancer Awareness Month, and today is the day. So, as with many of the conditions that I have shared this month regarding the uterine health or uterine cancer, this is another condition that I was not aware about, but definitely when I did my research, realized what an impact that it has on our uterine health as women. So, uterine prolapse. Uterine prolapse is a condition where the pelvic floor muscles and the ligaments stretch and weaken, causing the uterus, like the womb area, to sag, or in some cases, drop down into the vaginal canal. And so, if you could just imagine, you always see that picture, so that like your cervix, so it can even drop down into your vaginal canal. And they're saying in some severe cases, the uterus can even protrude out of the vaginal opening. So, like, you can even see it like it's something's coming out of you, right? Which I could just imagine that would just be, horrific and extremely scary, to be honest with you. So they say that this typically happens to women after menopause, who've had multiple vaginal deliveries. Um, but I did read someplace else too that it can happen even before that, even before you get into menopause, you can still have uterine prolapse occur. So some of the symptoms that you may have, I'm going to share about 6 of them with you. But just like I say, we're all different at all the time. Sometimes you may have a mild case of uterine prolapse and you experience no symptoms at all. And we know that from various other conditions, even our menstrual cycles, how some people can have a heavy flow and some people can have a light flow. Some people might have a lot of pain, some people might not. So with everything, so just like with that too, you might have a uterine prolapse and you might not know it because you might not have any symptoms. But if you do have some kind of symptoms that's causing you some kind of discomfort, it could be one of the 6 things that I'm just about to mention, or it could be something even more. So for number 1, you might have a feeling of heavy pressure or a pulling sensation in the pelvis or lower back area. The second thing is you might have a feeling or seeing a bulge of tissue inside or coming out of the vagina. The third, you might have a urinary issue, such as leaking urine or feeling like the bladder doesn't empty completely. The fourth thing, you might have difficult with bowel movements. The fifth thing is you might have pain or discomfort during sexual intercourse. The sixth thing is that you might feel a sensation like you're sitting on a small ball, or you're feeling like your vaginal tissues are rubbing against clothing. So those are just some of the symptoms that you could have if you have a severe case if you have a case, I'm just going to say, of uterine prolapse. Some of the common risk causes and risk factors. So the primary cause is the weakening of the support pelvic connective tissues and muscles. So that's the reason for it. So the pelvic floor has been weakened with the tissues around it and the muscles. So the risk factors include pregnancy and vaginal childbirth, aging and the dropping in estrogen after menopause, chronic straining, like from severe constipation or chronic cough, obesity, and heavy lifting. These are some of the risk factors and common cause for developing uterine prolapse. So pregnancy, vaginal childbirth, aging, and then the drop in the estrogen after menopause, chronic straining like a chronic cough or severe constipation, and obesity and heavy lifting is some of the common causes and risk factors. And uterine prolapse actually has stages. So when you go to your doctor and your doctor is, sometimes they're trying to feel around for your uterus, they should be able to um, determine, if your uterus is intact, high, low, or where it is within your whole womb area. They should be able to do that. But they do have 4 stages of uterine prolapse. The first stage is your uterus drops into the upper part of your vagina. So that's stage 1. It just drops into the upper part of your vagina. Stage 2, your uterus falls into the lower part of your vagina. Stage 3 is the uterus is protruding from your vagina. Stage 4 is your entire uterus slips out of your vagina. I'm going to repeat those stages over to you because I just was like, oh my goodness. So stage 1, your uterus drops to the upper part of your vagina. Stage 2, your uterus falls to the lower part of your vagina. Stage 3, your uterus is protruding from your vagina. And the 4th stage is your entire uterus slips out of your vagina. That's very scary to me. I just was like, wow. So they do have treatment options when you are developed with uterine prolapse, and the treatment, of course, like with all things, depends on the severity of the prolapse and how much it affects your quality of life. So there are 3 treatment options that you can have. You can have pelvic floor therapy, which includes like special exercises such as Kegels, or a physical therapy to strengthen the pelvic muscles. And what I recently found out about pelvic floor therapy, I just thought it was, like you go to a gym, you go to your regular physical therapy. A lot of times, or a good number of times, this is actually where you're working with a doctor or someone that specializes in this, and they're actually their hand is actually moving your uterus around too. So if you do have uterine prolapse, or if your doctor tells you that you need to have pelvic floor therapy, you need to make sure you know what it all entails, so you're not shocked when you go where you think you're going to do like some kind of therapy with your workout clothes on, and it's something more intense. The second type of treatment option is pessary, and that's a removable silicone device that's inserted into the vagina to physically hold the uterus in place. So that's something that it is removable, but they put it there to hold the vagina in place for you. The third option is surgery, and that's a procedure like a hysterectomy where they remove the uterus, or a uterine suspension to secure the uterus back into its normal position. So there is an option if I guess if your uterus totally comes out, or if it's way down low in the vaginal canal, that they can, secure it back to its normal position. So I just wanted to let you know what that is. And the type of doctors that you would see for uterine prolapse are like mainly your gynecologist and your urogynecologist. Remember, I talked about the various type of gynecologists they are. This is one where you would probably see your urogynecologist because they specialize in pelvic floor disorders and reconstructive surgery as well. So another reason that prompted me to have this conversation today was yesterday I was on the socials and I saw a woman that I follow. I knew she was pregnant and she was having her 3rd child, was complaining of something coming out of her uterus when she went to the bathroom. She told the first nurse, and the first nurse said, yeah, that's probably your placenta, part of your placenta still in there. And she says, don't worry about it. It should just naturally come out, which that kind of like alarmed me personally. And the second nurse said, oh yeah, that's probably a blood clot, because what she did was when she's laying in the bed, they couldn't see it. She said, no, come to the bathroom with me. So she actually had them come to the bathroom with her. And then that's when the first nurse said, oh, that's probably your placenta, part of your placenta. And the second nurse said, that's a blood clot. But she's like, well, that's a pretty big blood clot. And this is her, like I said, her 3rd child. And the nurses really didn't seem to know what was happening to her body at that, at that time. And she was prepping to go home that day. I didn't see her husband and her family in the room with her, so who knows? Maybe they went to get the car or something like that, because that's what she was prepping to do. And they were getting ready to release her. There were a number of comments from other medical professionals in the comments. Like one was from a double board certified. I talked about that what a certification means in one of my videos, but there was a comment from a double board certified. She's a urogynecologist and a reconstructive pelvic surgeon, in addition to being an OB-GYN. And she commented on the seriousness of this issue, and she was going to DM the young lady and talk to her immediately to walk her through. A number of nurses were in the comments, and other people that had gone through it themselves. And they said, this is a serious issue. Do not leave the hospital without them checking you out. So I don't know what happened to her. She hadn't posted after that. So I don't know if she was able to see all those comments beforehand. Sometimes people post and then they, she just had a baby, she probably got, busy with that. And, I saw her advocating for herself as much as she could, but I could only imagine as a woman who just had a baby, the fatigue, the tiredness, and the alarm. And she's such a sweet, young lady too. You can tell in all her videos, she's very lighthearted and, kind of comical. And so, I wish there was somebody there to, so she could just sit back and say, look at this, and really advocate for her, or maybe even look at her comments and say, oh no, we need to have this checked out immediately. So I'm praying that she's okay. But after seeing that video yesterday, it kind of reminded me, okay, I need to talk about this uterine prolapse today, because I think that it's a very like all the topics, very important for us to talk about, very important for us to know another condition that can happen to our uterine health, that it makes a huge impact on our uterine health. Because had I not seen this, if I would have saw my uterus coming out of my vagina, I know I would have freaked out, and as anybody else would as well. I mean, even if you know about it, you still may freak out about it. So again, my purpose this month on this channel is to provide information that makes you more knowledgeable, information that makes you have a better conversation with your doctors, information that makes you more aware and more in tune with your own uterine health, and makes you more empowered, makes you want to share this information with somebody. So if you hear someone says that, you can say, oh, that's probably a uterine prolapse. You need to talk to your doctor immediately. So that's my whole purpose, is to really bring empowerment to the uterine health. Because again, it's something that's silent, that we don't talk about the things happening within our wombs and within our uterus, and we need to empower it, because the more that we talk about it, the less stigma that it has, and the more that I believe that we as women will get better health care. That's just what I believe. And I want everyone to have a plan of succession for their health. So I do have three references as per usual, and I provide the references because sometimes we're tired. Sometimes we just don't even know where to begin. Well, because I've done some level of, internet research, I provide references that I think that might be of use. And I go through like a good 10 references. Like today I have 3. I go through a number of them, and sometimes I go, oh, I don't know about that one. So yeah. And then sometimes you have references that are more like a sales ad than they actually are providing you information. So I have 3 references, and sometimes within those references, they'll actually have pictures, and they go a little more in depth for you to read. So this is just, your launching pad to do deeper research. Sorry if you heard that noise. That's not a car crash. That is somebody driving too fast over a hump in the middle of the street. So the 3 articles I have here is from the Mayo Clinic, and it's called Uterine Prolapse, the Symptoms and the Causes. There's another one from the Cleveland Clinic from September 22. It's Uterine Prolapse, Stages, Symptoms, Treatments, and Surgery. The third one is from the Orlando Health from June 2025. Urogynecologist or OB-GYN, how to choose the right specialist for your pelvic health. I thought that was pretty interesting to put in there. So I hope, per usual, everything that I spoke today was helpful and beneficial, and you learned something new like I did. And of course, all of the references will be in the description below. So thank you so much for watching and engaging with the channel, and I hope that you have a great day. And until next time, take care, and don't forget, If you're feeling any discomfort, no matter what kind of discomfort is, make the appointment. Go to the doctor. Make yourself a priority. Okay? Talk to you soon.